healthcare transformation movement, Carnival, of which PediTales is being activated, it's been going on, and it's just a simple AI-structured, culturally relevant, age-appropriate story that is being told by everyone to be able to achieve emotional safety.
It's a process whereby we look at how patients move through different departments and units. We look at the pain points or problem areas wherever there's any kind of interaction between the patient's family and the medical side. And then we come up with solutions to those problems or pain points. We work with the teams on the ground so that the teams on the ground themselves become not only the people who are kind of coming up with the well-defined problems of the patients, but also coming up with solutions.
PharmCheck is a quality tool for continuous improvements. It was developed internally meaning across the Evercare group, Nigeria, Kenya, and Pakistan. And it was a tool developed to help identify the gaps, close the gaps, and help us continue to improve. It cuts across all the areas of the department, from staffing to infrastructure to medication storage to dispensing to patient safety. So we just do that to create a base assessment, and we monitor the gaps, improve on the gaps, and then do re-audits. And the beauty of PharmCheck is the fact that it can evolve. Once you close certain gaps, you can create new areas of audits and new areas of continuous improvement.
In 2024, we noticed some gaps and we've tried to adjust in our practice, and we've seen quite a number of beautiful outcomes, not just in the patients but in their caregivers too, and which has improved our services.
We realized that there's been an increasing trend of neonate arrival within the facility without any prior notice. The ER was not equipped to receive such cases, and as such we noticed that a sort of trend in which we're having poorer and poorer patient outcomes. With the implementation of the neonatal resuscitation area as well as the neonatal resuscitation equipment, the HCTM, we've been able to curb this downward trend and have seen a rise in positive patient outcomes of neonates arriving to the facility through the emergency room.
It was a beautiful experience that I saw my son coloring, he was so happy, and then after the coloring, he snapped, and they gave him a sticker, and he had a storybook, and it was fun. It was fun, it was beautiful. It's a nice initiative, so we want more of this subsequently.
I think the transformation is the audit tool itself, because this is new and it's innovative, and it creates an avenue for continuous improvement, because there's no such thing as perfection. You can think it's good today, and by tomorrow there's a gap in that same process. So that continuous improvement is the ultimate transformation for me.
That's just the changing dynamics that is required for our practice, and to give our patients the best, and even in the caregivers the best outcome also.
A way by which we can continually improve the quality of care we deliver to patients, no matter the kind of presentation.
Okay, the most interesting thing I've learned here today is the concept of transforming healthcare through applied data. I understand Evercare is trying to test and try new things. We are collecting of data and trying to implement things across their systems.
Yeah, I realized that hospital doesn't have to be a scary place for children. It could be a fun place. They could want to come to the hospital even when they're not sick. So when they are sick, it makes it very easy for them to come to be treated.
And the emergency booth has been really interactive and stimulating.
Paediatrics.
I'll give it a solid 9.
8.5.
9. 9.
9. 9.
What gives me the most hope are really the people of Evercare. Okay? And so I've loved working with the different teams at Evercare. In Lekki, I would particularly refer to the quality and patient safety team, because I work very closely with QPS. So patients and her team members who've been fantastic for all of this celebration event worked alongside of me. So quality folks, as well as all the departments, the HODs, the nurses. So my hope is really with the people of Evercare, and we're just getting started.